Well, I first developed pain in my knees around the 2008 area. They both became painful, particularly on the inside, and began to notice that I had difficulty walking and I was in pain most of the time. Nothing I had done to the knees on my own behalf, no major accidents, no heavy sports. My knees, my genetic makeup just caused my knees to wear out. And so, unfortunately, around 2008, they began to really ding me. Mainly on the inside, the meniscus was basically worn out on both insides of both knees. And slowly, that pain got more aggravating and worse as we went along. I would take a leave, and that helped somewhat. But on a daily basis, the pain level was about a 4 to a 5. If I did anything strenuous, working outside, lifting something heavy, digging in the garden, anything like that, the pain would go to a 5 to a 7. And they became, again, more painful, very difficult to sleep at night because of the insides of the knees. You can't lay on your side because the knee is touching the thigh or the other knee. And that became very painful. And so it soon became evident after a few years that I had to do something. I took a couple of cortisone shots in both knees. Those lasted maybe 6 to 8 weeks, and then the pain came back. I was limited in almost every aspect of my life. I'm a very active man. I live on a ranch, and I do a lot of heavy duty, from anything that you might imagine that a person could do on a ranch. Cleaning stalls, building fence, irrigation systems, cutting wood, doing concrete. I also full-time work as a manager at a local Ace hardware store, and very active during the day, and I was in pain most of the day, the level 4 to 5 again. It just became very difficult to work through that level of pain, and day after day, and you start thinking, well, we've got to do something, because that aggravated pain just does not go away. I started to seek medical advice again around 2011. I came to see Dr. Jamali, and I was at that point looking at knee replacement surgery. And I asked him what knee. I did some research on the internet, and became very fearful because I wasn't sure about what knee to get, and what were the problems with the knees. And the first time I met him, I asked him, I said, what knee do you use, and what's good about it and what's bad about it? And he said, okay, this is the knee I use, and this is why it's good, and there ain't no bad. And I said, that's really, I like that. And so as a result, we scheduled surgery. The right knee was a little bit worse than the left, so in 2012 I had the right knee replaced down here in Sacramento, and Dr. Jamali did that surgery. And then in 2013 I had the left knee replaced a year later, and Dr. Jamali also did that surgery.